Live. This is Good Morning Connecticut on News 8.
Postpartum depression affects more than 3 million women every year ahead of Mother's Day, and Maternal Mental Health Awareness Week is next week. Here to talk about a very important initiative to make sure that these new moms get the care that they need are Natalie Teletnikoff, founder of Better Postpartum, and Blakely Lowry, maternal mental health advocate with Health Right International. It's great to have you both here with us. What's the partnership between the two of you?
Well, thank you so much for having us.
You're
It's
welcome.
really great to be here to be able to talk about this important topic of maternal health. So, people might find surprising that in the United States, maternal death is on the rise, whereas everywhere else in the developed world it's actually declining. So there's something going on in the United States. It's really failing mothers. So we're really looking at what might be causing this to be happening. And we know that about 50% of pregnancy-related deaths are actually happening in the postpartum period. So that's why we've joined forces, because we're both maternal health experts around what we can do for postpartum health and make sure that women stay healthy through pregnancy and the postpartum period.
It's something that women don't really focus on, I don't think, anyway. What do you think, Natalie?
Yeah, that's exactly right. So really the fundamental issue here is that women aren't being taught what the signs and symptoms of postpartum depression or anxiety are.
Well, many women didn't even know about it until recently.
That's exactly right. I mean, and this is our lived experience too. That's why we've come together and we feel so passionate about this, is, you know, because I had postpartum depression after giving birth to my first son 4 years ago and didn't know it. So just suffered in ill health for the first year.
Did you basically just said to yourself, I'm not sure what's going on, but I don't feel well? How does that, how does it manifest?
We've talked about this, but it's really interesting because I think a lot of mothers just chalk it up to, this is what motherhood is like. Like, of course I'm tired, or of course I don't feel quite like myself. They justify it as, this is just normal, and they sweep it under the rug, and they don't look at the fact that there really is an issue, and there is a way that they could have better health and better happiness. There are things that you can do.
Well, let's talk about that in a minute, but maternal health, is there something we can do to prevent issues like this?
Yes, absolutely. So my organization has been doing maternal mental health work in Uganda, and where we're screening pregnant women for depression during prenatal visits. And if they are symptomatic of depression, we refer them immediately to on-site education around the signs and symptoms of depression, as well as self-help techniques to help them feel better. And what we've found is that when they come back a month later, 80% of them say they feel better, they have decreased symptoms. So we know, we have some evidence that education around the signs and symptoms actually helps people feel better, and we want to bring that model to the United States.
And patients should also be willing to share that with their doctors, though, because some patients don't do that.
Yes, yes. So we're giving them an opportunity to actually talk about that and feel comfortable talking about that.
Mm-hmm. Treatment for postpartum depression.
Yes.
What did you have to undergo?
Yeah, well, so because I was an undiagnosed and unreported case, and there are so many of those. So when we look at the statistics for postpartum depression, it affects as many as 1 in 5 women. That means that 20% of new moms are suffering, and they could be in better health, and they just don't really know where to turn. So they need support, they need resources, and they need education, and that's why I created Better Postpartum. So basically Better Postpartum is an online program where they would get educated about what they can do preventatively. It helps them avoid postpartum depression altogether or alleviate any of the challenges.
How can you avoid postpartum depression altogether?
So, well, there's so many facets to look at in a mom's new life. So there's hormones, there's postpartum nutrition, there's your physical recovery, mental, and emotional wellness. There's so many facets, and so the Better Postpartum program actually brings together the voices of all of these different experts, leading experts in the industry, and so they're able to really speak to this issue from every angle, from alleviating breastfeeding challenges, sleep challenges, anything. So Better Postpartum is really one of a kind. It's the only thing that exists like this, where a woman could get everything she needs in one place.
And how can people help?
So we are raising funds to make Better Postpartum accessible to as many women as possible during that prenatal and postpartum period, so they can become educated around the issues and become healthy. I think that the funds that we raise will make it available to as many women as possible.
And I guess most women who are probably the most at risk are those who are underserved and uninsured?
Yes. Yes.
So this is why your program is so important.
Yes,
Yes.
it's very critical for moms to be healthy.
Natalie Blakely, thanks so much
Thank
for
you.
joining us. Really appreciate it. And where should they go for websites?
Yes. So you can donate if you go to bit.ly/US Moms Matter.
Very good. Thank you.
Thank you so
Great
much.
information.